Hi, I'm Jennifer Allen reporting for RSNA News. I'm talking with Dr. Arlene Kanigan, Program Director for the Diagnostic Radiology Residency Program at the University of Alberta. We're talking about the pivot in education that occurred because of COVID-19 and how it has affected radiology residents. Thank you, Dr. Kanigan, for joining me today.
No problem.
First off, what type of virtual learning resources have been provided by the University of Alberta for their trainees?
The residents at the University of Alberta are very fortunate because they have the ability to view and review and report cases from home. So at the beginning of the pandemic, all the rotations were converted to home-based rotations. And then we ensured that all of our residents were set up to be able to view cases and report the cases from home. So they also had access to a provincial-wide electronic patient information system. So they could also review all the background necessary to actually review the cases and appropriately make the diagnoses and interpret the exams. And our home-based rotations were essentially a virtual reading room experience. So the residents and staff would be able to frequently communicate either by phone or through a secure chat box on the PAC system. And then at specific times, they would have virtual readout sessions with staff. And those often occurred over a shared screen type format with a secure Zoom chat room that our university and our health services also provided. They were actually able to maintain somewhat of a normal type of reading room experience for a number of rotations. And speaking of the Zoom platform, all of our rounds and didactic teaching sessions were converted to virtual sessions. So the academic half days, morning rounds, grand rounds were replaced by virtual settings. And the residents also relied heavily on electronic learning resources that program provides subscriptions to. So these include resources such as StatDX and Rad Primer, the ACR Exam Bank, and eAnatomy. And these resources were an integral part of the home-based learning, and also many of them provided opportunities for self-assessment and documentation, which could then be shared with the rotation preceptor. In addition, I think this applies to most residency programs, but there's a vast array of free, high-quality online resources for radiology learning. And we had initially started providing these lists on our own, but it became quite evident that there's a lot of collaboration between programs, and very extensive lists were then shared widely by organizations such as the American Alliance of Academic Chief Radiologists. So there's a vast array of online opportunities for our residents.
So for early radiology residents, how has this disruption affected their education?
It's kind of twofold. Certainly when the pandemic started and the residents were sent home, it just happened that many of our junior residents were supposed to be on rotations that required a lot of hands-on, skill-based teaching. So things like ultrasound, where they're learning how to scan, and fluoroscopy, where they have to be in the room working the equipment. So definitely there was and is a deficit in some of those types of skills. And they kind of counteracted that deficit by being able to increase the learning and the reading around some of those rotations. So they are probably a little ahead in terms of their medical knowledge, but definitely have some skills to make up as their residency moves forward. Now, fortunately, the junior residents have a few years to do that. So what we're doing is adapting future rotations to incorporate more of those skills and enhance some of the deficits which they unfortunately experienced.
So the University of Alberta provides credit for wellness activities during the residents' time away from the reading room. Why was this important during the pandemic?
It's well established that resident physicians suffer high levels of stress and depression and burnout. Recent published research from our own institution demonstrated prevalence of feelings of burnout among Canadian residents approaching 70%. So it's definitely a problem. And this was even before the COVID pandemic. And when the pandemic hit, added feelings of uncertainty and anxiety, plus all the social isolation, added to the mental stress and put the psychological well-being of our resident learners at even a greater risk. So our program really prioritizes wellness activities and supporting our residents. So during the pandemic, we felt it was important for us to do whatever we could to support their well-being. And current recommendations suggest that to combat burnout and mental stress, it requires more than just resiliency training and individual effort, but more organizational change as well as a cultural change. So this was really our opportunity to put something structural in place to support well-being. So when our program converted all of the resident rotations to home-based rotations, we then needed a clear structure, uniform expectations, and a means of accountability. To address this, we developed a credit-based system in which the residents would earn credits for a variety of learning and self-assessment activities. All the activities would be documented by the resident, and then they would be required to earn a certain number of credits per week to complete the rotation. And this was all done in conjunction and supported by the preceptor of the resident rotation. And to address the wellness concerns, we then incorporated the expectation for self-care and wellness activities into the home-based curriculum. So residents could earn credits for up to 2 hours of wellness activities per day during work hours, which would then count towards the total requirement for the completion of their rotation. So this could be an activity of their choosing, but the residents were provided with resources and suggestions such as exercise, online yoga, and meditation to incorporate into their wellness curriculum. And the University of Alberta also offered virtual counseling and mental health services. And by building wellness time into the design of the rotations and assigning it a credit value equal to a more traditional academic activity such as learning, the program hoped that the wellness activities would increase and this would improve resident well-being. And the feedback that we got from residents was very, very positive. I've had comments like the residents were happy not to feel guilty about taking care of themselves, and they were happy that the program really valued and supported their well-being. And some of the things that people did were going for a bike ride or going for a walk with their children or spending time with their spouse, as well as other things like yoga and meditation. So they were very happy that they could do this during the day because it was very stressful to try to read for 8 hours straight or just be online for 8 hours straight. So I think the morale was improved and nothing but really positive comments about that change we made in the curriculum.
So moving forward, how different do you think radiology education will look?
Well, I don't think we will probably ever go back to how things were before, at least in our program. There have definitely been a lot of advantages and things we've learned about going to a more virtual format. So it allows for flexibility in terms of scheduling and in terms of location. It has allowed for a lot of collaboration amongst residents in our department as well as programs in other institutions. The University of Toronto invited our residents to attend some of their virtual teaching sessions, so that was really great. So I think some of the positive we would really like to move forward, but on the other side, you can never really truly replace the kind of face-to-face and viewer side teaching. As great as the virtual aspect can be, the residents really do miss being able to review cases with their staff and have the personal interaction. So I imagine it's going to be some sort of a hybrid system going forward, but definitely we will be keeping the virtual format for a number of things, I think, from this point forward.
Thank you, Dr. Kanigan, for your time today.
All right.
For updates and the latest scientific research, guidelines, and consensus statements about COVID-19, visit rsna.org/COVID-19. And as always, you can find more radiology news at rsna.org/news.